So who is this masterclass for? Really, it's for all healthcare professionals. I'm sure every single one of you will be able to get something out of the masterclass. You might decide to participate in all 10 sessions, which will be 2-hour webinars taught every 2 weeks over the course of 5 months. The course is very patient orientated. You will transform the lives of your patients, improve their quality of life and healthcare. But also it is very career orientated. For example, if you are a practitioner there setting up a false clinic for your patients, this course is for you. If you are a general practitioner or primary care physician who would like to improve your skills in the care of older people, or in fact develop an interest in frailty and become a general practitioner with interest in the care of the elderly, this course is for you. If you are someone who is setting up a business, a private enterprise, delivering a private healthcare to older people, join my masterclass with mentorship, and I will teach you a lot about private practice. If you are a medical student or a junior doctor, this course is for you as well, because guess what? Majority of your patients out there will be elderly, and it will make so much sense seeing them and treating your patients once you've completed my masterclass. If you are a pharmacist, whether hospital-based or community-based, this course is ideal for you. A lot of pharmacists are now involved in polypharmacy reviews and de-prescribing. A lot of you are now prescribers, and this course will help you to make the right decisions for your patients. Or maybe you are a paramedic there who is specializing in the care of older adults. This course will be ideal for you too. The first webinar will be about frailty. You will understand the medical concepts of frailty. You will appreciate why patients decondition so quickly and how can that be prevented. Join the webinar to find out more. The second webinar is on dementia and delirium. These two are very much interconnected. We will be talking about how to prevent delirium in our patients and how to treat complications of dementia. There will be a lot also about care planning in our dementia patients. The third webinar will be my favorite subject of polypharmacy and de-prescribing. We will be going through multiple cases. It will be all based on real case scenarios where we will be together going deep riding through patients' medication lists and getting the best outcomes for them. The fourth webinar will be on bone health in the elderly. Here we will be talking about osteoporosis, osteomalacia, vitamin D deficiency, and the treatments. The fifth webinar is on end-of-life care, and in our survey, very many of you requested to have a webinar on end-of-life care. We will be talking about how to recognize end-of-life care in our patients, how to communicate end-of-life care to patients and relatives, and how to plan for the future. The sixth webinar will be another favorite, as we identified from the surveys, and that is Cardiovascular Geriatrics. And here I will be presenting with Dr. Michael Jackson, a specialist cardiology pharmacist, and we will be talking about heart failure in the elderly, atrial fibrillation, hypertension, and other cardiovascular conditions. Sixth webinar is Preoperative assessment in older adults. Our surgical patients are getting older and older. The geriatricians and general practitioners and surgeons need to work very closely together to optimize our patients prior to the surgery, as well as know how to look after them after the surgery so we can get best outcomes from the surgery. From my clinical practice, I often observe patients coming out with really good outcomes as far as surgery is concerned. However, the medical complications halter the recovery. The eighth webinar is going to be on old age psychiatry. And here I will be talking about anxiety, depression, and psychosis in the elderly. I have extensive experience in old age psychiatry. About 50 to 60% of my patients presenting with various medical conditions also have mental health conditions, so I treat them together. The 9th webinar is going to be really exciting, and it is going to be called Guess the Diagnosis. So I will be putting out the cases out there where slide after slide I will be asking you for your diagnosis. We will be having a discussion together, then reaching the diagnosis together, and then talking about the subject. And the last webinar is really bringing all of this together. We will be talking about various geriatric tools which you can use in your clinical practice. We will be talking about setting up services, whether it's a full service or dementia service, and really talking about comprehensive geriatric assessment, CGA, how to bring all of this together and be able to do the CGA in 90, 120 minutes within your clinical practice.